Are you 40 years or older and bothered by your neck? My name is Dr. Sagar Patel. I'm a Beverly Hills facial plastic surgeon. One of the procedures I specialize in is chin lipo, and oftentimes I struggle with guiding women as they get older into what procedure is best for them. So let me start by answering a basic question. Will lipo make my skin sag? The answer is no. Overall, there is a trade-off as we get older to doing lipo. It is never going to be the best procedure for an aging neck. That, in fact, will be a neck lift where we're removing skin, tightening muscle, removing multiple layers of fat, and preserving the texture of the skin. However, the question isn't whether lipo will work, is the trade-off of what the downsides are worth it. So what are the downsides? Well, as we get older, our muscle in our neck called the platysma, which initially sits really tight based on your anatomy to your jawbone, starts sagging with time. As that sags, the fat on the inside protrudes more, and that creates a double chin appearance. Oftentimes, the best surgery at that point isn't just to remove the fat from the outside, but actually to open up that muscle, tighten it, and remove the fat from the inside. This brings the skin with it and is termed a deep neck lift. Now, if you are able to do lipo only, that's because your muscle hasn't started sagging, and once it starts sagging, it also starts separating, creating bands. Now, if we can do lipo, that's because there's either enough fat on the outside or that muscle has not started sagging at all on the inside. If there's enough fat on the outside, then the dilemma becomes the skin. The skin always, as we get older, will lose elasticity and gain laxity. This is kind of the comparison between a rubber band that when you stretch it out and let go, it snaps right back, to a grocery bag where you can stretch it out, but then it doesn't deflate the same way. Now, in that sense, the skin will not contract smoothly, but it will contract. And because of that, we are able to see a little bit of the underlying structure underneath the skin, which is going to be that muscle. The muscle's very low. Specifically, when you look up, you'll be able to see it. Now, while this isn't ideal for the average patient, some patients are willing to live with that exchange of seeing the muscle, specifically when you stretch, and having some what we call crepiness to the skin as it contracts onto the muscle. That crepiness oftentimes people already have, and so a little bit more won't bother them. And then at other times, it's gonna be something that's worth a trade-off because a neck looking slimmer is gonna make their whole appearance look younger. Overall, you have to be very careful, mostly with the muscle. If the muscle is very loose, then even though lipo will give you results, it's gonna be the wrong surgery as opposed to going to the wrong surgeon. And oftentimes people blame the surgeon when it's really just the surgery at fault. Doing lipo as you get older, the only things we can do to control the skin are going to be wearing a compression wrap longer. Now, there's also other options like using energy-based treatments. Overall, I don't believe in this as people get older because I haven't seen results that equivocally tell me that FaceTite or Renuvion J plasma changes the protocol of what you can do. I don't see the value in spending that extra money. It's not going to be guaranteed to be all of a sudden now someone's a candidate for a surgery. If you're over 40 and your neck bothers you, this video hopefully helped explain to you what your options are, whether it's a deep neck lift, a full neck lift with removing skin, or a surgery like chin lipo where you have some downsides, but overall can see some improvement. Hopefully you're gonna find the answer for yourself. Don't forget to like this video, subscribe to this channel, leave a comment below asking me about a specific question you have about chin lipo.